Hello, hello, hello. Welcome, welcome, welcome. How's everybody doing tonight? It's your Uncle Jim, and we're back with another edition of Kidney Stories 2. And tonight, I have something extra special for you. We're going to be talking about medical nutritional therapy and registered dietitian nutritionists tonight. And we have a couple of experts with us to help us through this and to talk to us about how this applies to kidney patients. First, we have Dr. Melissa Prest. She is the foundation dietitian for the National Kidney Foundation of Illinois. She is a registered dietitian nutritionist and a board certified specialist in renal nutrition therapy who provides medical nutritional therapy for chronic disease patients, other chronic disease conditions, behavioral changes, and nutrition education. We also have with us tonight Marsha Schofield. Marsha is the Senior Director of Governance and Nutrition Services Coverage for the Academy of Nutrition and Dietetics. She wanted to make sure I got this out, so I'm going to say it in the introduction. Part of her work focuses on increasing access to registered dietitian and nutrition care for kidney patients. So let's bring on our guests, and Uncle Jim will start asking questions. Hello, hello, hello. How are you?
Good. Doing great.
Good. I wanted to say, after everybody's credentials, there's a lot of alphabet soup after both of your last names. So I'm going to start with Dr. Prest and ask her, please explain your qualifications and a short explanation of what it is that you do.
Sure, thank you. So hello, everybody. I am Melissa Prest. I'm a registered dietitian nutritionist. I have been a registered dietitian nutritionist for 17 years. And within the 17 years, I have worked in a variety of practice settings. I've worked with patients in the hospital setting and long-term care setting. And I spent over 10 years working with people being treated with dialysis in a dialysis center. I have a bachelor's, master's, and doctorate all in clinical nutrition, and then I have an additional certification for renal nutrition specialist.
Okay, great. And I used to be a notary republic. Marsha, please tell us what your qualifications are and explain to us briefly what it is that you do.
Sure, thank you. So excited to be here with everybody. Similar to Melissa, I'm also a registered dietitian nutritionist, and I think we'll be talking a little bit more about what that means. I also have an undergraduate and a master's degree in nutrition. I've worked more years than Melissa has in the field. I'm not going to tell you how many, but more. And birth through the elderly. I've done all age groups. I've worked all different places within the healthcare system. So hospitals, outpatient, dialysis centers, physician offices, long-term care, home health, just any place you can think of where you might encounter a healthcare system. I think I've done it in some way, shape, or form. Most recently, it's actually for 9 years now, I've been working at the Academy of Nutrition and Dietetics, which is the national association that supports and represents registered dietitian nutritionists and advances our field and our practice and tries to help all of you live healthier lives through nutrition.
Great, great. Let me direct a question to both of you, and then you decide who answers first. What is medical nutrition therapy? This sounds like something above and beyond going in to see your nutritionist that took a couple of classes in college. What exactly is medical nutrition therapy?
Marsha, do you want to start, or do you want me to start it?
Why don't you go ahead and then I'll add to it.
Okay. So with medical nutrition therapy, what we're doing is we're working within the healthcare team to use various nutrition interventions to help you manage a disease condition. So with chronic kidney disease, for instance, we look at how the foods that we're eating, and we make specific nutrition prescriptions for your diet to help your kidneys function better, to help preserve the kidney function longer if you are in an earlier stage of chronic kidney disease.
And I'll just piggyback on that. It does sound like a very technical term, and there is a lot of science and experience that goes behind it. So, you talked about the alphabet soups. We've definitely gone through a lot of training in order to practice in this area. It's very individualized and customized, and I think that's important for people to understand. This isn't just pull off of the shelf some book about nutrition, but it really is a method of care and a process that we follow to really assess an individual, what their healthcare needs are, work with them on what their goals are, and come up with a very individualized and customized plan of care that we work together and help patients and individuals support with their goals in mind of preventing a chronic condition from getting more complicated, maybe not getting one in the first place, and just trying to get you the best outcomes possible related to whatever that condition may be.
Okay. Marsha, we'll start with you this time for this question. What is the goal of MNT, medical nutrition therapy? What are we trying to accomplish?
Well, what we're trying to accomplish, no matter what the condition is, and in this case, I know, people here today are very interested in kidney disease, but whether it's that or some other thing, it's really trying to figure out how you can think about what you eat, how you eat, when you eat, to get the best outcomes, to keep whatever the condition is under control, to prevent it from getting worse, to prevent other things popping up from a medical standpoint that could really get you down a path that you really don't want to go down to in terms of your health and well-being and quality of life. And it's all through, the power of food and nutrition to do it.
Okay. Doc, I'm a kidney patient. I have polycystic kidney disease. I'm 60. I wish I was 44. I'm 66 years old now. I have complications with ulcers and diverticulitis. What would the goal be for someone like me for medical nutrition therapy as a kidney patient?
So as Marsha was talking about with the disease management. So when I'm working with someone, it's really about how can we ensure, one, that you still have a great quality of life and that you're able to do all those things that you want to do. And we also want to focus on how can we ensure that your health is as optimal as it can be. So obviously you're being followed by a physician and you have another team of healthcare providers with you. So how can you incorporate the nutrition and diet part of that to kind of complete that treatment picture? And so we might look at, modifying parts of the diet if you're having symptoms with diverticulitis per se, or maybe you're having some kidney symptoms. So we will look at different things that we can do with your diet to try to alleviate some of those symptoms and, again, optimize your health.
Okay. Marsha, talk to us a little bit. We've been throwing around some terms. What is a registration dietitian nutritionist? What a mouthful. What is that person? How is that person different than someone who holds himself out to be a dietitian but doesn't go through the same criteria?
Sure. Yeah, we did really make it difficult for you with all these terms tonight, and hopefully the audience can keep it straight too. But a registered dietitian nutritionist, it's an individual, and that credential, it is a credential, like an MD has a credential, an RN has a credential. It's a national credential that says this is an individual who's completed a minimum of a bachelor's degree. Many dietitians have masters and beyond, like Melissa and I have talked about, but it's a minimum of a bachelor's degree. It's a set program of study that has predefined things. You've learned about anatomy and physiology, how the body works, biochemistry, all the nutrition science. There's a lot of science in there, but that credential says you've successfully completed this education. You've also completed what we call a supervised practice or an internship. So similar to how a physician does internships and other fields do it. You've practiced under the supervision of somebody who is already a registered dietitian and shown level of competency in the work that you've done. And then finally, you pass a national exam that tests your knowledge. And you get the credential. You have to maintain continuing education to retain the credential. If you don't, you have to retake the exam again along the way. And in some cases, actually, there are dietitians who also get licensed to practice within the state that they work. But basically, it says you've got the classroom knowledge, you've got the practice knowledge, you've shown competency through an exam, and you have that credential. And so we always use the saying that all registered dietitians are nutritionists, but not all nutritionists are registered dietitians. And that's because there are people out there who may just use the term nutritionist to describe or label themselves, but they haven't gone through that same rigor of education and training and maintenance of the knowledge base that RDN credential signifies for the consumer.
Thank you. Dr. Prest, I understand that you have an advanced degree, a specialized certification in renal therapy as part of your experience. Can you tell us what educational experience that you went through to achieve that?
Sure. So, in addition to what Marsha was describing in terms of the educational pathway, I did complete a master's degree, which is at this point not required for registered dietitian nutritionists to obtain. But I did go on and complete a master's degree and a doctorate. And with both of those, there is a research component that goes into that. And so my research was focused on patients being treated with hemodialysis. And then also, since I was working with patients on dialysis and with chronic kidney disease, there are board certifications within our Commission for Dietetic Registration, which is the accreditation body that also maintains our registration status. And so they have various different board certifications. So there's one in oncology, I think geriatrics and nutrition and sports nutrition, and there's a few other ones that are available. And so having worked, I want to say it is around 2,000 hours. After you have about 2,000 hours of work within the chronic kidney disease population, you can then sit for and take a board exam. And that just allows other consumers to recognize that someone holding that credential is someone that spent a lot of time working with individuals that have chronic kidney disease. But not everyone that has been working with individuals that have chronic kidney disease necessarily have this particular board certification. So it's an optional certification that you can take, but it was one that I opted to take because I thought it was important just to have that visibility and recognition.
Okay, thank you. Thank you very much. Ladies, I read somewhere that roughly half of the renal dietitians from the academy have some form of advanced degree. Is that a true statement?
I know that over half of the registered dietitians have an advanced degree. So I would say that's a true statement, that many of us, go above and beyond the minimum requirements to ensure we've got the expertise we feel is needed to practice.
And I will say within the kidney community for dietitians, typically dietitians need to have at least a year or two of experience working in a clinical setting. So that would be hospital-based or long-term care, some type of clinical setting before they can work in a dialysis facility. That's a requirement from the Centers for Medicare and Medicaid Medicare Services, so CMS. So that's a lot of at least some experience that when there is a dietitian that you're working with in a dialysis center, that they're not brand new graduates. These are providers that have some experience and knowledge before going in, because the area of kidney nutrition is a highly specialized area. There's a lot of complexities going on. As you know yourself, being a patient, it's a complex disease state to manage. So, the dietitians working in that area do have prior experience going into it.
Okay. And would it be a fair statement for me to make that because of your education, training, and practical experience, that this makes a registered dietitian nutritionist a credible source for nutrition and diet information? Would that be a fair statement for me to make?
Yeah, absolutely. And I know, Marsha will probably fill in on this a little bit more as well. We do have a lot of just information for the public talking about on the eatright.org website. That's just talking about what a dietitian is, what they do, that, we are the nutrition experts. And so based on all of our working knowledge, that's why we're an important member of that healthcare team to provide medical nutrition therapy, because we have a lot of specialized practice for that. So Marsha, I'll let you add to that question.
Well, I think you did well. Absolutely. We consider ourselves the nutrition experts, but I do think, that's not just making something up and feeding into our egos in any way. Yes, because of all those things we talked about in terms of training and experience, there's really nobody else out there, unless I'm forgetting somebody, who has that same foundation on which to put their hat of being an expert in the field of nutrition. Granted, there are a lot of physicians who may get board certified in nutrition, to add on to their medical field, but we're really the primary group that I think you can fairly call the experts in that area.
Okay. We have a question from our friend Gloria. It had to do with renal nutrition therapy and high platelets, high or low platelets for someone that's on a low-based plant diet. Can you respond to her question, please?
So I'm just trying to follow the question. So she's on a plant-based diet, but she's having some problems with platelet problems. So some of that might actually be more related to either medication or a medical condition. So I don't want to say, it's hard always to provide tailored individual, nutrition recommendations kind of in this forum, just because there's limited information that we have access to. I will say in general, for patients who are on our kidney patients, having more plant-based foods is typically recommended because it does help to keep the acid load low, and that's what we want for our kidneys to work better. We want to have a more alkaline, which is really just a fancy word for saying a fruit and vegetable rich diet. So that is something that we want more of, but there may need to be some changes within the types of foods that maybe she's eating for the platelet issue itself. But I again, I don't want to go too far in the weeds on that, just because I don't really have all of the information for her medical history here.
That's a good point that I want to make with my questions tonight. When you guys come up with a plan, a diet and nutrition plan for an individual patient, that's exactly what it is, right? Very, very individualized.
Right.
It's not a one size kind of thing.
That's some
Yeah.
of the difference of working with a dietitian versus, once again, there's a lot of information on nutrition out there. Everybody eats. There's lots of great, good general information for the generally healthy population. But the distinction here is individuals who have very unique needs based on their own personal health profile. And so we really do customize it for that. So, to our friend Gloria out there who asked the question, I think that's a perfect example of, Gloria, if you're not already working with a registered dietitian nutritionist who you can go back to and who knows you and can answer that question specific for you, might be a good time to have that conversation.
Dr. Prest, I'm a kidney patient. Why is it a good thing for a renal dietitian to give kidney patients advice on their diets?
Well, again, like I was saying earlier, people that are working with kidney patients, typically they're going to have at least a year or two of postgraduate, post-dietetic intern experience working one-on-one with patients and providing medical nutrition therapy. So they have a little bit of background with that. And then they would go on and do further information and training just for kidney-specific conditions. And so as I was saying, that it's a very complicated disease state. And so someone who's a general practitioner for a dietitian may know some of the basics of the renal diet, but they may not know all the nuances. They may be focused in a different area of nutrition. There's so many different areas where registered dietitian nutritionists can work in. And as you can assume, there's a lot of different research and information that changes the way we practice and expands the way that we practice. And so someone that's really focused in chronic kidney disease and kidney nutrition is most likely going to be someone who's been keeping up on the research, keeping up on the latest guidelines, and keeping up on what's the best way to treat someone with kidney disease.
Okay, let's talk about doctors and nurses for a minute. My doctors and nurses often talk to me about what I should and should not eat. Why isn't this enough? Please explain to me why it's inadequate.
So
I'm sorry, how does medical nutrition therapy help not only patients, but doctors and nurses as well?
Sure. So there's a couple of things with that. So one, I typically will have patients that contact me because they're just very confused. So maybe they've gotten some information from their doctor, and like most people, they're doing more external research on their own. They're looking things up on the internet. They're talking to family members or friends, and there's just so much information. It gets really confusing. So one of the great things that registered dietitian nutritionists are able to do is they take all of that science and all that information, and they can really distill it down and simplify it for you. So while you've been given kind of this, do this, don't do that sort of list or discussion from a nurse or a physician, sometimes that gets lost or there's some confusion there. And so it's always great to follow up with someone who then is an expert in the area to really help distill down that information. Then, as Marsha was saying earlier, part of what registered dietitian nutritionists do is they really look and customize a diet plan for you. And so with the kidney diet, I think with all of the latest research that's come out, we're really looking at individualization of this diet. So while you have this food list of don't eat tomatoes per se, that may not be appropriate for you. And so there may be a list that you were given that's just this blanketed kind of yes, no list, but it really may not be the most appropriate thing for you. And so that's where registered dietitian nutritionists can come in, look at everything on that treatment plan, talk with your physician, talk with your nurse, and can kind of work together to really kind of help you customize that plan. And then the other thing is time. Physicians and nurses have only so much time that they can spend with patients, and really the registered dietitian nutritionist time is billed and spent to be doing this one-on-one education and counseling and customization of the plan. So that time factor comes in as well.
Okay. Marsha, what does a renal dietitian nutritionist do beyond what a doctor or a nurse does? What's unique about their advice? What is the added benefit in consulting with a renal dietitian? And Bobby, shout out, and yes, I will send you the link.
Sure. I think we've spoken to it in terms of just that specialized expertise. One of the messages I think it's important to get across is healthcare, in my opinion, and many others, I'm not unique in it. It's a team sport, and the patient is part of the team, but there's a whole team of people who are there to come together and do the best in the best interests of an individual and to support what their personal goals are. And so, you know, just like a football team, a baseball team, you have these people in specialized roles. And sure, can I, play first base and second base? Maybe so, maybe not personally. But, you develop your role that everybody says, you're the person who's going to handle this piece, and all together with the individual, at the center, we're all going to be part of figuring out what you need, what you want, how we can best support it. And so once again, we may reinforce one another. The doctor and the nurse, we're hoping are going to reinforce the plan that the dietitian puts together with the patient. But, work with the expert on that piece of the plan and let the others reinforce it, just like we're going to defer to the physician for deciding, okay, what is the best medication for you to be on, or what's the treatment modality that you need, what tests do you need, and then we can reinforce that and design things around it. But it takes a team, I think, to take best care of individuals with kidney disease. And so that's why I say, tap into the dietitian for that piece of it, have one on your team to complement and work together with the rest, and let everybody focus on their expertise and bring it all together.
Excellent, excellent. Doc, I've been through the whole gamut for a kidney disease patient. I've been pre-dialysis. I was diagnosed when I was 25. I was on dialysis at the age of 58 for a 4-year period, and I was transplanted in 2016. Generally speaking, what is the difference in advice that you give to a pre-dialysis patient, a dialysis patient, and then one of us that's been transplanted that's taking immunosuppressants?
So, obviously the nutrition therapy that we provide is going to change depending on the stage of kidney disease. So typically in kidney diseases stages 1 and 2, your kidneys are functioning fairly close to normal. 2, we obviously start to see some decline. So at that stage, we're generally really focusing on, if you have any other health conditions, can we manage those health conditions really well? So that might be high blood pressure. Are we managing your high blood pressure? Is your blood pressure staying in a good range? Have we lowered it? So maybe we're looking at doing a low salt diet. Maybe it's the DASH diet, which is dietary approaches to stop hypertension. And so that diet is, again, very much plant-based, low sodium, high fiber, lots of great fruits and vegetables in that one. So we might look at that. Maybe it's controlling blood sugar management. So we want to make sure that we have really good blood sugar management. We're focusing on your diabetic diet. Then when we start getting down to stage 3 and stage 4, we start to see a decline of almost half of your kidney function from stage 1. So at that stage, we start looking at protein. And so we'll start customizing protein type and how much protein that you're eating. And I always start to educate and talk with patients about phosphorus. So we're not necessarily restricting phosphorus at that time, but we're starting to learn what the heck phosphorus even is. How do we find phosphorus in our diet? And why is that important? So we start talking about that. Some physicians may start talking to their patients about potassium. And so then again, we'll talk about what's potassium and how do we manage potassium when we look at fluids. So really the very beginning stages of chronic kidney disease, we're just wanting to focus on just overall health, disease management. We may start to see some diet modifications as the kidneys start to decline. once someone's on dialysis, that's typically your most restrictive kidney diet. And so that's when we start with all these P words that gets really confusing, but we start looking at modifying your phosphorus foods, your potassium foods, your protein foods, the sodium, the fluid. So there's a lot of different parts of that diet that we're talking about and modifying. And all of that is really to kind of help with that external kidney that's working to clean your blood, 3-4 times a week. And then once you get the gift of an organ transplant, at that point, we want to make sure that we don't reject the organ, right? So then there's additional medication that you're taking, and you may have some issues with weight gain or with high blood sugars because of that medication. So we'll focus on, making sure that we're watching weight management or controlling blood sugars. Some people may or may not have a recurrence of high blood pressure, so then we'll have to, kind of focus on that. And then obviously we just really focus on making sure that the food we're eating is safe, because again, we want to make sure that you're not back in the hospital or rejecting that organ. So we really focus a lot on food safety. So that is a whole lot, but just really it just shows that it's very different depending on what stage that you're in. There's a lot to it. And it really just shows, again, that value of working with someone that has that expertise and knowledge in it to help kind of guide you through it and be your partner on that kidney journey.
Thank you. Marsha, do your dietitians, are they concerned about the vitamins or the supplements that people take? Is that something that you take into account when you create a plan for that particular patient?
Absolutely. We'll look at any medication or supplement that somebody's taking. So certainly any vitamin, any mineral things, it's really important to know all the components, because some of them may be, very appropriate to use based on where you are in that kidney journey that Melissa very well spelled out. So some of them may be, hey, this is perfect, will help you right now. But sometimes some of them, with all good intentions of taking them, you just don't realize that, oh, wait a minute, that could be causing a problem with my kidney function, or maybe interacting with a medication that I need to be on. And so, it could be working against you or not giving you the benefit that you were looking for. So we always want to know whatever people are taking, whether it's prescription or over the counter, so that we can make sure that it fits in appropriately with that plan to meet your goals.
Is there such a thing as a holistic renal dietitian therapist?
I don't know if I do know there are people that probably, I'm sure there's like a certification. I think there's some certifications. I don't know them off the top of my head, so I do apologize about that. I would say in general, if you think of the word holistic, it's talking about that whole picture. And registered dietitian nutritionists practice the whole picture with the patient anyways. I think that's how we're trained to practice, and that is what we look at. So not only the diet, but we're going to look at how does that even manage for your lifestyle? Is that something that's appropriate? Is this plan appropriate for you? Maybe you're someone that is recently widowed, you've never cooked for yourself in your entire life, and you're on your own with your food. So obviously, providing a meal plan to you with a lot of complicated recipes and things to prepare, it's not going to really work for you. And so that's where, the dietitians, when you're working with someone, that we're looking at that whole picture. So it's sort of a holistic view of it. But I know a lot of times that thought of holistic is that it's talking about more of like herbal supplements or maybe some complementary medicine therapies. But if you think about food and nutrition as a whole, that's really the base of any good diet and lifestyle. And that's always included in any type of holistic plan in general. And just like Marsha was talking about with supplements, I think all dietitians are food first people. So we want to make sure that people are getting most of their nutrients from the foods that they're eating, as opposed to relying on supplements for those foods that they are eating. And so, kind of just looking at that whole picture in general is what we are trained to do.
Marsha, the goal of meeting with a registered dietitian therapist is to come up with a realistic plan to improve your health and lifestyle that's tailored to your individual needs. Tell us a little bit about what happens the first time that you sit down with an RDT. What is the process that you go through? What kinds of questions do you ask?
Yeah, thanks for asking because, sometimes there's this mystery about what goes on in that room, when you're together. And, you're asking, like Melissa talked about, a very holistic thing. We're going to, if we don't already have the information from a physician, the whole medical history, what health conditions do you have, or maybe risk factors you have based on your family history. So we're going to look at that. If lab tests have been done, we're going to look at the results of the lab tests. We're going to ask about, prescription medications, over-the-counter medications. So there's a lot of data that comes in. We're going to ask you, a typical day of eating. What does it look like? When do you eat? Where do you eat? Who do you eat with? Type of thing. Are you working? Just your lifestyle in general. If you are working, is it working third shift at night? Are you working a desk job? Are you out doing construction work? Just understanding, the whole situation, who's in your household, to understand, are you just worried about meal preparation for yourself, or are there others involved? What cooking facilities you have, type of thing. Do you eat out? How often? What do you like? What are the places you like to go to eat out? And really, most importantly, as we're getting all that information, I'm going to ask somebody, so what are your goals? What's important to you in terms of your health and this kidney journey along the way? Somebody in the early stages, it may be, I just don't want to go on dialysis. What do I do to try to keep off of it for as long as possible? Or you've had the transplant, and it's like, what do I do to preserve, this gift that I've been given? But that holistic approach of understanding, your lifestyle, even your exercise habits. Do you exercise? Don't you exercise? Do you smoke? Do you enjoy alcoholic beverages? It's nothing judgmental in terms of this is good, this is bad. It's just understanding, who you are, what your life looks like, what your eating habits look like. Even, what are some of your special foods, or, that we really want to try to work around if we can, to make this something you can do every day for your life, not just I do it for a little bit, but it really isn't speaking to what's important to me, and working around the things that are important to me. Do you do the grocery shopping? Does somebody else do the grocery shopping? It's all those things related to um, how food fits into your life and what your life looks like.
Okay. I have read that um, a registered dietitian can be as specific as talking to you about reading labels on products and tracking your progress. Doc, can you tell us a little bit about that? What is that all about?
Yeah, so I always talk about being a food detective with the people I work with, because especially with people with kidney disease, a lot of the things that we want to know about aren't necessarily listed on the food label like other nutrients are. So phosphorus, for instance, I talked a little bit about that earlier. So if you don't know what phosphorus is, it's a mineral. It works with your bone health. And so in someone who has kidney disease and isn't producing a lot of urine, you're not able to really clear the phosphorus from the foods that you're eating, and what you would normally do if your kidneys were working. And so excess phosphorus can be a problem for your bone health and your heart. So we will look at the food label, but phosphorus isn't necessarily listed on the food label as this food contains X amount of milligrams of phosphorus. So we have to be a detective, and we have to learn a little bit more about the food label than just here's the calories and the serving size. We really dig down into the ingredient list and we learn about how do we find phosphorus in the ingredient list so that we can understand if the food that we're going to choose or consume has added phosphorus in that. So that's one thing that we do look at. I would say potassium is now listed on the food label. So that was a long time in the making. So I am happy that that is available on the food label now. But we do really kind of have to go in and learn a little bit more about the food label, I guess the basics, when we are talking about making good food choices for kidney health.
Okay. After the initial meeting, I have read things that a renal dietitian therapist will do things like help the patient plan meals, actually take a tour with them at the grocery store, that they'll read products on or labels on products, and that they will track your progress to see how you're doing. Can you talk to us, Marsha, a little bit about what that's all about, what the follow-up meetings are like?
Sure. Yeah, that first meeting after, it's a get to know you session, come up with, okay, what sounds like a good plan to meet your needs. We always do. We're going to check back in. We're going to see, okay, you set these goals in terms of, maybe watching your phosphorus intake or, looking for certain sources, increasing fruit and vegetable intake, that type of thing. So then we're going to come back and it's like, okay, how's it going? We'll have other data, maybe like new lab results that you've gotten or updates on medications and treatment and your health status. But from the nutrition side and the meal plan, it is a chance to talk about what went well. Where did you feel successful in meeting your goals? Where do you feel like, hey, I could have done better on it? Or that idea just didn't work for me. So then let's, just similar to being the detective, let's be problem solvers together. Let's say, okay, let's come up with some creative solutions. If that didn't work, what's something else we could try that could make you more successful along the way? And like you said, there's nothing better than some of those hands-on opportunities to learn about things. So whether you go to a grocery store together, which I've done that lots of times, let's meet up at the grocery store and we'll walk through the aisles and we can look at what is it you're thinking you want to purchase. Let's look at that label. Let's talk about how would this fit into my meal plan? How might I prepare it? Type of thing. So, we might go to the store and do it, or we might within my office where you meet with me, or if I'm in your home, or these days via telehealth, it's like, okay, let's open the cupboards, take the product off the shelf at home, and let's look at the label together and talk about it. And use those tools, to look at things. I never like to think of it as, like you're getting graded on the test. We set these goals. We sent you home to do your homework. You come back and you get a pass or fail type of thing. It's like I've worked with patients who've said, oh, I'm going to cancel the appointment because I wasn't good. And it's like, no, come. That's really when we need to talk about got in the way, what made it difficult for you to do these things, and let's problem solve. Or once again, things changed with your medical condition, then let's talk about maybe we need to change X, Y, or Z at this point to adjust for the changes that are going on with your health or just your lifestyle. You started a new job and it's changed when you're eating, and I'm packing a lunch instead of eating out or something. So those are the types of things in the follow-up session when we look about tracking progress that we're really focused on is working together to support your success.
Okay. Doc, does a registered dietitian go over your lab results and explain the effects that it has on your diet?
Yeah, so that's definitely something that every dietitian within a dialysis center is going to do with the people that are being treated there monthly. So it's reviewing the lab results. and talking about how can you make adjustments to your diet based on your lab results. And then again, if you are not on dialysis, but you're looking to prevent further decline in kidney function, reviewing those labs with the person that you're working with and talking about how can we make sure that your diet that you're consuming is one that can preserve that kidney function and really optimize kidney health.
Okay. Marsha, let's suppose that the client has allergies or sensitivities or intolerances. How does a renal dietitian work with people that suffer in that way? What types of things do they do?
You know, you bring up a good point, because these situations can get very complex. You know, you talked about your journey and everything, but yeah, you just don't know what any individual is going to have along the way. So, you know, we are going to sort through if they say, you know, a certain food bothers me in some way or I'm allergic to it. You know, is it really that you can't eat it at all because you're going to have, you know, one of those anaphylaxis reactions where you can't breathe and you end up in the emergency room? Or is it, you know, a mild discomfort along the way? So, you know, we're going to want to gauge, you know, how serious is this? To what degree do we have to avoid it? And then we're going to have to weave that into whatever the plan is that we determine, to say, okay, well then, you know, maybe there's, you know, peanuts as a food that we're just going to have to try, you know, avoid, and do some of that detective work that Melissa talked about, because sometimes these allergies and intolerances, they're hidden in places and in foods that you might not think about. And so we might have to do that. Sometimes it might be as part of that detective work. I've worked with people to say, well, let's keep a journal. Let's, you know, write down what you're eating and what these symptoms are, because you want to make sure you're really solving for the right thing. And so sometimes you need to go through that type of exercise to become more aware, because you were thinking, you know, I thought it was the Brussels sprouts that were the problem. But as we track it and document it, you say, you know, I really think it could be something else. And let's try playing around with that. Sometimes we can talk about it and say, you know, so you just don't eat it and life will be fine. You might miss it, but maybe we just leave it out and that's the answer. But other times it might be that, you know, no, maybe we can work it in, or if we remove that type of food, maybe you're at risk of not having enough of some vitamin or mineral or other nutrient. And so then we have to say, how do we compensate for that when we take away, you know, or limit eating these other foods? So those are the types of things we're going to, you know, look at and work on together to try to
Good.
help you.
Good, thank you. Doc, I have read that a registered dietitian helps you find substitutes for food that you're not supposed to eat. Can you address that issue? Please tell us what that's all about.
Yeah, sure. So if you think about, say, potassium. So potassium is a common mineral that is rich in fruits and vegetables. It's also really common in all of the protein foods that we eat and dairy food. And so you may have been instructed to follow a lower potassium diet. And so what we will do is we'll say, okay, well, maybe we can't have a baked sweet potato for this meal for your side. So here are some lower potassium options that you can do for a side. Maybe it's rice, maybe it's noodles, maybe we're not going to have a grain. We're going to look at some green beans and we're going to add on a green salad with that, or some fruit. And so that would be, you know, kind of swapping out those higher potassium foods for lower potassium ones. So you're still getting your fruits and vegetables in, but it just have to change the ones that we're doing. And so we would look at all different parts of the diet for that. So the same with phosphorus. So maybe maybe you want to have cheese, and so instead of having say cheddar cheese on a bagel, we'll talk about cream cheese, because that's a lower phosphorus cheese that you can have on a bagel. So it's looking at what are the things you need to modify and what foods would better fit to help you modify your diet without having you give up the taste that you would enjoy.
Thank you. Good. Marsha, can I just go in on my own and schedule an appointment with a registered dietitian, or do I need something more?
So, technically you could just call up somebody and make an appointment. The thing becomes, how is it going to get paid for? So if you're hoping to get it covered by your health insurance policy, which most people, right, that's what you're probably hoping for, then there are a lot of situations where, depending on that policy, they are going to require your physician to have made a referral for you. If you schedule directly with the dietitian, often we can circle back with your physician to get that paperwork in place. So don't want to say you can't do anything without it, but like I said, there are some ties to getting it covered through your insurance company where having the documentation of a referral is going to be needed.
Okay. Doc, I read something and the other day about Medicare Part B and covering the cost of payments, and I was kind of shocked because I've been a kidney advocate for around 20 years now, and Dr. Kramer mentioned this to me too, and I didn't realize how payment works with Medicare. Can you talk about that a little bit, please?
So, like Marsha was saying, with Medicare in particular, you want to make sure that you have a referral from your physician, and that way the dietitian can bill Medicare for that visit that they have with you. The other thing with Medicare is that it's fairly prescriptive in terms of how many sessions you can have with a dietitian. So, you can have an hour for that first session, and then you can have, so many sessions the rest of the year as follow-ups. There are some additional codes that a dietitian can bill for to get you some additional sessions if needed. But it's a little less than the amount of time you can spend seeing your physician every year. So there shouldn't be with Medicare any cost to the patient as long as there is that referral coming from the physician office for Medicare. Now, private insurance or commercial insurance, that may be a little different. Sometimes there's co-payments or co-insurance, and that really is dictated by that insurance plan. So it's similar to if you went to see your primary care doctor and you had a $20 copay that you had to pay to get a physical or a health and wellness check. So your commercial insurance may dictate that you'd have to pay a $20 copay to talk with the registered dietitian if you had that commercial insurance plan.
Okay, let me make sure I understand this.
Mm-hmm.
As long as you have a doctor referral and you stay within the limit of Medicare's visits, your first year, your second year, you have so many visits, CMS is now paying for 100% of those services without any out-of-pocket costs to the patient under Medicare Part B. Is that a fair statement, ladies? Everybody's nodding their head.
And I see
that
Marsha's head. Yes.
That is the best kept secret in kidney.
It is.
Right there.
And that's why we love the opportunity to say it here to your audience, because it's been that way for many, many years. And it does feel like the best kept secret out there. And it's year after year after year. There's not a limit to the number of years. So every year you have to refresh your referral from your doctor, but every year you can keep accessing those services at no cost from Medicare.
And the Academy of Nutrition and Dietetics has a Find an Expert on their website. So you can go to that, you can put in your zip code, and you can actually even refine it down by people that focus in renal kidney diseases, and then you will have a list of providers in your area that are registered dietitian nutritionists that can provide medical nutrition therapy for you in your area. So that's a tool that's available free of charge for anyone that wants to find a registered dietitian nutritionist.
Okay, ladies, let's talk legislation. The National Kidney Foundation and the Academy are advocating for the Medical Nutrition Therapy Act, HR 6971 and Senate Bill 4504. Why is this bill needed and what does it do? We'll start with Marsha.
So it does so many great things, but in a nutshell for everybody, one of the reasons we're doing it, the people here with kidney disease, we just talked about the wonderful benefits they have under Medicare Part B for medical nutrition therapy. But unfortunately, those benefits, you have chronic kidney disease or you've had a transplant, you're good. You have diabetes, you're good. That is it. And there are so many other chronic conditions where nutrition can have a huge impact on people's health, managing that condition, staying off of medication, staying out of the hospital, a lot of things. And so that bill is designed to expand the conditions that Medicare patients with Part B coverage can see the dietitian for at that no cost opportunity, that same build out. So heart disease, GI conditions, that are going on. You talked about, ulcerative colitis and things like that. Malnutrition. There's just so many chronic diseases that have a connection with nutrition that right now Medicare doesn't cover. The second really important thing it does comes back to that referral piece that we just talked about. There's a really important distinction or limitation right now in that it has to be a physician who makes that referral for your Medicare patient. So if you're working with a nurse practitioner or a physician assistant, which many people are, especially in rural areas of the country, they can't make the referral. It has to be a physician. So the legislation is also designed to remove that barrier to access.
And just so everybody understands, one of the chronic diseases that's not covered, that would include cancer.
Yes.
That would include obesity.
Yes.
Okay.
And I just wanted to add really quickly that high blood pressure and diabetes are two of the leading causes of chronic kidney disease. And so right now, diabetes is covered under Medicare, but high blood pressure isn't. And so if you're someone that has high blood pressure and a family history of chronic kidney disease, you're likely at a fairly high risk of developing that yourself. So having that expanded access to a dietitian to help you manage the hypertension that hopefully will never then progress to kidney disease in the first place. So, having that ability for other health conditions, because they will then touch on other conditions that may occur. And so just being able to see a dietitian earlier really to help you manage that is what, I think a big part of this bill would help as well.
Okay. Let's talk a little bit about how COVID-19 has altered the way that renal dietitians work. Does that include telehealth visits? Are they covered by Medicare? What precautions are being taken to protect both the patient and the dietitian? Let's start with Marsha.
Sure. I'll talk about the telehealth piece, and then maybe I'll leave some pieces for Melissa to talk about. Even without COVID-19, I think it's important to know that Medicare has for many years covered medical nutrition therapy as a telehealth service. What's changed with COVID-19, which has been absolutely wonderful, is in the past you had access to it only if you lived in certain geographic places, these rural areas or areas that they call professional healthcare shortage areas. But, basically rural areas, you could get services via telehealth and still this no cost situation. But you live in the middle of a city, where there's lots of healthcare providers, well-populated areas, you couldn't. So with COVID-19, very unfortunate situation that we're dealing with, but it has opened up the access to the dietitians and medical nutrition therapy any place in the entire country. And the other thing that has been good about it is you can stay in your home now and get the service. I, as the person providing the service, can do it from my home. So it keeps both of us safe in place to be able to do it. So, like I said, while it's an unfortunate situation that we're dealing with, those are some positive things in terms of your access to these nutrition services via telehealth that are available right now. And, everybody's advocating hard to be able to continue them. So when we're not under a public health emergency, but at least for now, because we know patients with kidney disease, with high blood pressure, obesity, diabetes are at much higher risk for COVID-19 and unfortunately often have poor outcomes. And nutrition can really make a difference in that as well. And so being able to keep the access going for patients with kidney disease or at risk who really need it, being able to do it safely via telehealth, continuing to keep it as a no cost, out of pocket cost for you, to just keep you healthy, minimize, the risk for COVID-19 and potentially poor outcomes. That's been tremendous. Melissa, you may want to talk about.
I will say that.
1 minute, please. 1 minute. Marsha,
Oh, sure.
we're being asked about the link for people that they can find or locate a registered dietitian therapist. What is the link to your website for the academy where they can find that?
For that piece of it, we have a public-facing website. It's eatright.org. That should be really easy to remember. But if you go to eatright.org, front and center, you'll see a place you can click on for Find an Expert.
Okay. Doc, how are we protecting our patients and our registered dietitian nutritionists from SARS the virus?
Yeah, so for most patients, at least with my own experience working with people that have chronic kidney disease not on dialysis, that is all moved to a virtual space. That's all done through telehealth. For my colleagues that are working in the dialysis center and particularly home dialysis, the home dialysis seems to be utilizing a lot more of the telehealth as well for visits. A lot of times if you're someone on a home modality, you would come into the dialysis center or the treatment center. Sometimes those are freestanding buildings. So you'd come in once for lab draw, once for clinic. And so oftentimes they might only come in once for lab draw and then their clinic visits being done via telehealth. So I do have some colleagues that are working within hospital systems and dialysis providers that are doing this hybrid telehealth and then also having a clinic visit with a patient as well. And then obviously, utilizing the proper protective equipment within the center. I know that there's been dietitians that are helping in the dialysis centers with taking temperatures for patients before they come into the center to make sure that their patient coming in doesn't have a fever or symptoms that may infect staff or other patients in the facility. And then I have colleagues that work with transplants and post-transplant and again, other CKD or kidney stones. And so I think the non-dialysis sphere is really utilizing telehealth a lot. And then kind of a little bit of a hybrid mode within the actual dialysis center.
Okay. Ladies, I appreciate you taking time with us tonight to educate us about medical nutrition therapy and about renal dietitian and nutritionists, but I'm out of time, so Steve says he's got to go. Any rate, I wanted to alert people on the 15th of December, Dr. William Goggins is going to return and talk to us about what's going on with kidney transplants down at IU Health, and specifically what's happening with the vaccine for COVID. The next couple of Fridays is the 25th of December and the 1st of January. Obviously, I won't be on then. I will be on again on the 29th of January. I have kidney royalty that's coming to talk to us, as my friend Lisa Baxter would say. Extraordinarily gifted kidney advocate Valen Kiefer is going to be on with us, so you do not want to miss that. At any rate, I just want to wish everybody well. Have a good holiday if I don't get a chance to talk to you. Thank you again, ladies, for educating us, and we'll see you soon. Bye-bye.
Bye. Thank you.
Okay, thank you.
Thank you. Thank you very much for talking to us.